What is bariatric surgery?
Bariatric surgery is that class of surgical procedures that is performed by a surgeon to assist a patient in losing weight.
Are there different types of bariatric surgery?
There are different types of bariatric surgery. A procedure may be simply a restrictive procedure where a band is placed around the stomach, for instance, or it may be as involved as a bypass type procedure where in fact we create a small pouch with the stomach and then bypass part of the intestines and attach it to the pouch. And for each of these procedures there may be different consequences, different rates of weight loss, etc.
Can bariatric surgery be done with minimally invasive techniques?
The most dramatic change in bariatric surgery over the last 10 years is in fact the incorporation of minimally invasive surgery techniques. In a recent study that was done that showed a dramatic improvement in complication rates, an approximately 30% reduction in complication rates, this was attributed primarily to the utilization of minimally invasive techniques. At Winthrop, we do 99% of our procedures using laparoscopic techniques or robotic surgery. And in fact, we were the first hospital in the state to really incorporate robotics for bariatric surgery. This really contributes to less pain for the patient, safer outcomes, and we're proud to offer this.
Is bariatric surgery the best way to lose weight?
Bariatric surgery is not necessarily the best way to lose weight, but it is the way that is available for those patients who have tried everything else. And certainly it's not the first resort in losing weight, but should be a last resort after a person has tried diet, exercise, behavioral therapy, etc. So it's not necessarily the best way, but it can certainly help a patient who has exhausted other means of losing weight, help them to lose weight and correct all their metabolic and medical problems.
How would I know if I'm a candidate for bariatric surgery?
One would be a candidate for bariatric surgery if the person has weight that's 100 pounds overweight for what they should be. Also, we look at a formula of the weight divided by the height, and that gives the body mass index. If that body mass index, or BMI, is over 40 or greater, the person would be a candidate for surgery, and that is the National Institutes of Health criteria. If, on the other hand, the body mass index is between 35 and 40, and the person has health conditions, comorbid conditions we call them, heart disease, diabetes, sleep apnea, or any medical condition that's causing a problem, then they would be a candidate for surgery as well. Recently, the FDA announced that they would approve an extension of this candidacy down to body mass indices from 30 to 35 if the person has comorbid conditions, and those patients would be appropriate for gastric banding.
What are the risks of weight loss surgery?
That's a very good question. All surgical procedures have risks. Bariatric surgery is surgery, and certainly there would be risks to the procedure. The procedures vary in terms of the risks. The complexity of the procedure may carry slightly more risks. A simpler procedure may have less risks. These, however, should really be discussed with the person's physician because that patient may have some very specific features in their health history that may put them at risk for certain things. I will say, however, that a recent study done by Health and Human Services looked at risks and complications of bariatric surgery in recent couple of years compared to, let's say, 8 to 10 years ago, and found that there's been a 30% reduction in the risks related to bariatric surgery. And they attribute this primarily to the fact that we're using now minimally invasive type of procedures compared to in the past. So it's a good question, but I think it's best is discussed with the person's physician.
How much weight can a person lose with bariatric surgery?
The weight loss after bariatric surgery really is dependent upon the effort of the patient. I think in general, most patients can expect to lose from about 50 to 80% of their excess body weight. However, I should caution that it really is important that the patient is participating in the process, that the surgery is really only a tool to help them achieve this weight loss. Those patients who follow up with their physicians, attend support groups, and are much more involved and encompass and incorporate really all the aspects of a comprehensive program, those patients are much more successful than a patient who simply has an operation and really doesn't do anything else. So healthy choices in terms of eating, portion control, and certainly some form of exercise program is very important in achieving really ultimate success.
Is it okay to become pregnant after bariatric surgery?
Many women ask if they can become pregnant after bariatric surgery, and our recommendation is that they wait 18 to 24 months before becoming pregnant. That is primarily related to the fact that in that early period of weight loss, the patient may not be getting enough micronutrients that the fetus would get and need for the early period of development and growth.
Does insurance cover bariatric surgery?
That's a very good question. Most insurances at the present time do cover bariatric surgery. However, we do advise all patients that they should contact their insurance provider to understand whether they do have full coverage for bariatric surgery. We have people in the office who will investigate that as well, but it's really important for the patient to contact the insurance provider.
If a person is considering bariatric surgery, what should the first step be?
If you're considering bariatric surgery, the first step would really be to gather as much information as you can about the surgery, the procedures, and outcomes, etc. Then we really invite you to attend one of our educational seminars, and you can contact us at 1-866-Winthrop and get more information about where these seminars are located and their times.
If a person has bariatric surgery, how long will they be in the hospital?
Hospitalization after bariatric surgery really depends on what procedure is performed and certainly the patient's health conditions. In general, patients who have gastric banding can expect to spend possibly one night in the hospital or even possibly go home the same day, depending on their health conditions. Gastric bypass patients tend to stay probably 2 nights in the hospital on average, and patients who have sleeve gastrectomy or some type of revisional procedure may expect to stay 1 night in the hospital as well.
How soon can a person go back to work after bariatric surgery?
Returning to work after bariatric surgery really depends on what type of procedure the patient had and certainly what type of work they're engaged in. If someone had a banding procedure and is simply sitting at a computer or in a desk job situation, then they can certainly return to work within a week. We advise patients to take a couple of weeks off, not simply because of the surgery itself, but because of the adjustment and lifestyle and taking time to make sure that they follow the dietary regimen that we have for the program after the surgery. If someone is involved in heavy lifting or very vigorous type activity, then certainly a 2-week transition period postoperatively would be advised.
How important is exercise after the surgery?
Exercise is very important after bariatric surgery. Exercise helps in the recuperation period. For instance, in the immediate postoperative period, within 2 to 3 hours after surgery, we have our patients up and walking, and that's very important in preventing blood clots and other problems such as pneumonias and respiratory problems after surgery. After that initial first 2 days, we want patients walking regularly, not really exercising at a gym, but walking at home, around the block, and over the next 2 weeks, walking for possibly about 30 minutes if possible. After that 2-week period, we ask patients to begin to increase the level of activity that they're doing, and at about a month, I think it's okay to get back to gym-type activities. Those patients who are the most successful after bariatric surgery do incorporate some form of exercise in their postoperative regimen. We encourage patients to do something that's measurable, either in the number of hours that they're committing to it per week or in the distance that's being covered. Not simply walking around at home, but being able to say, I can do a treadmill for 30 minutes, or I can walk down the street for 30 minutes, or I can walk a mile this week or 2 miles next week. That's the type of activity we really want to encourage.
How can I find out more about bariatric surgery?
If you'd like to have more information about bariatric surgery, Just visit us at winthrop.org or call us at 1-866-WINTHROP.